Hi, my name is Missy Huggett, and the disability that I'm going to be talking about today is spina bifida. There are three types of spina bifida, and the first one I'm going to talk about is when there really isn't an effect at all. And this one is called spina bifida occulta. And sometimes it is not even developed, like it's not even diagnosed because the child doesn't have symptoms of it, or it is diagnosed later when they're a teenager or into their adult life. Maybe the doctor notices it, but it doesn't cause birth defects or physical impairment or any sort of cognitive disabilities either. The second type of spina bifida is visible at birth, and this one is called maniocele, in which means that there is a sac of fluid that forms on the outside of the baby's back that comes through the vertebrae, only there is no part of the spinal column or nerves that end up in there, so it can be fixed relatively easy. And oftentimes if there is a disability that happens, it's very minor. Now the type of spina bifida that most people think of when they hear about spina bifida is the third type, and this one is called myelomeningocele. And that means that the sac of fluid that forms outside of the baby's body does have part of the nerve endings, and there is part of the spinal cord that's in there. Now, depending on how much of the spinal fluid and how much of the nerves and spinal cord are in that sac depends on how severe the disability is going to be. So sometimes it's pretty minor, and the child will be able to walk with aids as they get older, like they might need a walker or braces on their legs. If it is pretty severe, then it could be that they are in a wheelchair or need other sort of adaptive equipment to help them get around. Now, spina bifida is something that happens in 1 in every 10,000 babies in the world. So 1 in every 10,000 births can end up with a child that has spina bifida. Now, it is higher in some places in the world, like in the British Isles or like in Ireland or in Wales. The chances of having a child that has spina bifida are 3.5 per 1,000 births, and they're not quite sure why that is. They're wondering if it's a genetic piece. There still is no real known cause to spina bifida. They just notice that some incidences have a higher chance of getting it. Now, one thing that they have noticed in the United States is that the Hispanic population has a higher incidence of having a child with spina bifida, and one of the things they're wondering about in that situation is, could it be that they're not getting the proper prenatal care and getting the folic acid that they're recommending, because they have found a link between folic acid and spina bifida. And so that's the reason that when women are in the age of childbearing years, that they recommend them taking a vitamin that does have folic acid in it. Now, if a child is born and they do have spina bifida, some of the things that could happen to them would be that they would have some physical impairments. Like they could have some paralysis in their legs. They could have some incontinence in their urinary and bowel systems. They could have a lack of feeling in their skin. And if there is a really big buildup of fluid in the spinal cord, it may cause the brain to swell, and there could be some brain damage. So there could be some cognitive issues in children where that happens. So these children that are born with spina bifida will work very closely with a physical therapist that will help teach the parents how to help get that child the proper exercise that they need. If their legs aren't working properly, they still need to make sure that they're getting exercise to those areas so that their legs can still stay strong. They would also see a gastroenterologist, or could also see a urologist if they have issues with their urinary tract or their bowels. Sometimes they are unable to empty their bladder or their bowel and could have issues with that. Their language and literacy and their cognitive areas would depend on if there was swelling in the brain and if there was some brain damage in that area, they might have issues. So there could be some cognitive delays, and then they would work with a special ed teacher at school to help work on those delays and see what improvements can be made that way. The only area out of the 5 developmental areas that they might not have an issue with would be the sensory, just because they aren't noticing that necessarily there would be any sensory needs in their areas. Some cultural implications are, in the United States, it is very interesting that the Hispanic culture does have a higher incidence. So they're wondering if that could be because maybe the family is uninsured and they're afraid to go in and get prenatal care because they're worried that they could be deported if they are here illegally. It could also be a financial issue. Maybe they don't have insurance and prenatal care is expensive. So there's a few things that they're thinking about in that area as to why they have a higher incidence. What they're finding is that children with spina bifida, they tend to be happy and go-getters. They tend to lean a little bit more on their family and their caregivers because they rely on them to help them get places. So they could have some needs in social emotional. They also are working on treating spina bifida in utero. That is pretty experimental, so they're still developing some of that.